be the boss of your own health, right? Be the CEO of your own
Yes.
health. And I say that because a lot of people always talking about, especially women, we always talking about being the boss of something, right?
There you go.
But we don't own our health. And
Yes.
the thing is that when you go to the doctor, I was saying too, you have to be transparent. You all can't help us if we're not being transparent, and then we have to educate ourselves, not to self-medicate ourselves, but to be able to have an educated conversation with your physician. And you really need to have a conversation with your physician, correct?
That is very important. Thank you for bringing that up. When you're going to see your physician, you should have questions for the provider. You ask them questions with regards to the medical condition that they've diagnosed you with or that you already know you had. Ask questions such as, what should you expect? Even the medications they're giving you, especially if you're on multiple medications, you want to know what each of those medications does so that if something is changing, you know more or less what could be causing the change. Ask about side effects of the medication. Ask about if you have a chronic condition. Ask what is expected, what is the progression of this disease. Ask about what will land you in the hospital, what would cause a flare of the disease that you have, and also what are some of the things that you should look for that should alarm you that things are going south or things are going okay. And there are even certain times when you just have risk factors in your family. You don't have a chronic condition, but that condition runs in your family. There are things you can do to delay having those conditions or even stop the conditions from happening to you. Common things are like cancers. You have common cancers that run in certain families, and you want to be able to know the screening, how you should screen for those cancers. Screenings help you diagnose early enough, and most cancers, if diagnosed early enough, can be treated. So it's very, very important to know the things that you need to undergo screening for. Yearly examinations or monthly or annual examinations, or even 2 or 3 years. It depends. Depending on the condition, the screenings are different. And not everyone has to undergo every type of screening. It depends a lot on your history. So it's very important to know your own family history. Very important to know any conditions that you are at risk of having. Very, very important to ensure that you're doing the regular screenings that are recommended by the CDC, recommended by the United States Task Force, recommended by the reputable bodies that govern those areas.